Good afternoon and welcome to our Learn and Share conference call. I'm Russ Derry, Director of Education for Epilepsy Foundation of Michigan, and I'll be moderating this discussion. The topic for today is Program Spotlight, Children's Special Healthcare Services. And we're pleased to have as our speaker Lisa Huckleberry, who's a parent consultant with the Family Center for Children and Youth with Special Healthcare Needs. Lisa, can you briefly introduce yourself and talk a bit about your background and the work that you do?
Sure. Thank you, Russ. I am very excited to be here today and share information on these two wonderful programs. And I have been with the Family Center for over 11 years now as one of 5 parent consultants within the Family Center. I oversee the outreach and education component of the Family Center program, but also serve in multiple roles such as providing emotional and informational support to families, attending Medicaid health plan site visits, creating trainings, and also answering the CSHCS family phone line. I am a parent of an adult son and a teenage daughter who was born with Down syndrome and has many other medical conditions. But she's the reason I am so passionate about supporting other families through their journey. As a parent of a child with special needs, my experiences, knowledge, and advocacy skills serve as a wonderful connection to other families who also have a child with special health care needs.
Okay, great. Well, again, thank you so much for joining us today. So can you start by giving a very basic overview of Children's Special Healthcare Services and the Family Center? We'll go a lot more into depth later, but just kind of the overview of what those two organizations are and what they do.
Sure. So Children's Special Healthcare Services, also for short, CSHCS is what I will be referring to it throughout, is a program within the Michigan Department of Health and Human Services. And CSHCS is mandated by Title V of the Federal Social Security Act in the Michigan Public Health Code. It was created to find, diagnose, and treat children in Michigan who have chronic illness or disabilities. CSHCS is funded in part through federal and Medicaid dollars, the Maternal and Child Block Grant, and fees from payment agreements. CSHCS serves children, youth, and some adults who have one of over 2,500 different diagnoses that CSHCS covers. Our program also helps families pay for medical care and treatment relating to the child's qualifying diagnosis and assisting families with their insurance costs such as co-pays, deductibles, and insurance premiums. The Family Center for Children and Youth with Special Health Care Needs, also known in short as the Family Center, is the statewide parent-directed center within Children's Special Health Care Services Division and also the Michigan Department of Health and Human Services. The Family Center offers emotional support, information, and connections to community-based resources to families of children and youth with special health care needs. This includes all children who have or at an increased risk for physical, developmental, behavioral, or emotional conditions. Children do not need to be enrolled in CSHCS to receive services from the Family Center.
Okay, and that's an interesting distinction I wasn't aware of. Because I know that Children's Special Healthcare Services it focuses on physical conditions, and so I didn't realize the Family Center also served people with emotional or developmental disabilities. So
yes, absolutely, because at the federal level, under the Maternal and Child Health Bureau, while CSHCS is limited to what they can do, we are still, as a Title V agency, should be supporting all families in any way we can. And so we utilize what we can from the Family Center, and I'll share a little more later, by offering emotional support and different scholarships for families, even if they have a child with autism or ADHD or something like that.
Okay, great. So can you review the eligibility requirements for Children's Special Healthcare Services, the application process, and the associated costs?
Sure. So in order to be eligible for CSHCS, you must be a Michigan resident, a citizen of the United States, documented non-citizen, lawfully admitted for permanent residence, and the diagnosis must meet CSHCS chronicity and severity requirements. And it's also required that you must be seeing, or your child must see, a physician specialist at least once a year. You must be within the age limits of the program, which is under the age of 21 or age 21 and above with either cystic fibrosis or certain coagulation disorders. You must have at least one of the CSHCS qualifying diagnoses. Families of all incomes are eligible to join, including those with other health insurance. So you may also have other insurance, whether it's private insurance, Medicaid, or My Child and Medicare. But the first step to determine eligibility, because we don't send out applications because so many people would not be eligible. So first we determine if that person is eligible. So that step involves having your specialist send in a current medical report or complete what we call the medical eligibility report form. And so you'll have the specialist have the medical report from the subspecialist will want to show the primary diagnosis or diagnoses if there's more than one, current problems noting that chronicity and severity, current treatment plans, such as what are your medications, what services do you need, equipment, providers, possible anticipated hospitalizations or tests, and type of care that's required, and also must have a specialist signature. It cannot be from a nurse practitioner or a social worker. And then also you may have a payment agreement to join CSHCS, and that payment agreement is based on family size and income. But like I mentioned, we do not have any income requirements. You could make $1 million and still be eligible to join the program. But you can also have Medicaid and be on the program. But if you do have Medicaid, there is no fee to join.
Okay. Now, does epilepsy confer automatic eligibility, or are decisions kind of made on an individual basis? I'm guessing from what you said so far, it is sort of on an individual basis. But can you think of any situations where a child diagnosed with epilepsy may not be eligible?
Sure, and this is a really good question, and this is something that's very confusing in many different diagnoses, because we know, just as in epilepsy, you can have, someone may, be seizure-free now. Maybe they're not on any medications anymore, and then someone else may have uncontrolled epilepsy, right? So, and this is why all eligibility is made on an individual basis. And so the situation I would think of in where a child with diagnosed epilepsy may not be eligible is, like I mentioned before, so maybe they are no longer having seizures, they're not taking any medications, they're doing really well, they are not going to see their epileptologist or neurologist yearly, although, and you can correct me, Russ, you would have better knowledge of this, I would still assume most people with epilepsy at least check in once a year, but it could be that maybe they're so far out and they're doing so well they no longer need that, because that one piece of that criteria is that you have to see a specialist at least yearly. So if you're not going every year and now it jumps to 2 years, that would be a reason that you would not be eligible.
Okay, yeah, that makes sense. So,
makes sense.
So someone who has, for instance, had a stretch of being 1 year seizure-free, but isn't necessarily their epilepsy isn't resolved, and they do continue to take medications, and they do continue to see a neurologist or epileptologist at least annually, they're likely still going to be eligible.
Absolutely.
Okay, great.
And sometimes, and I'd just like to clarify as well, sometimes, if somebody is doing well and maybe they're not going for every 2 years, and they can still reach out to us and see about getting a referral for a diagnostic evaluation. And what that means is they'll work with their local health department, and basically that visit can get covered and any testing can get covered, and then if any new diagnoses or anything changes, they can be put back on the program. So you can be on the program and off the program and back on it.
Okay. Can children qualify under more than one condition, or do they have to apply under what's considered their primary condition?
No, actually, for each diagnosis, they will just have whichever specialist they may be seeing would just in a medical report based on whatever that diagnosis is, and our medical consultants at Children's Special Health Care will review that, and if it's determined based on that set of eligibility criteria I mentioned, if it is determined that they are eligible, they will add on that diagnosis as well. For instance, like I mentioned, my daughter has Down syndrome. We do not cover Down syndrome as an umbrella diagnosis, and so she does not get covered for that, but she has been covered for a congenital heart defect that required surgery, hearing loss, scoliosis, and a bunch of very different things that most likely have to do with the fact that she has a genetic condition, but we don't have that one umbrella term, so she gets covered for all those different specialists.
Okay, great. And can you talk a little bit about the application process? Is there online application? Is any element of it online? Is any element of it by phone? Is it all done in person? I guess, can you just walk us through that application process?
Sure. And because, like I mentioned previously, this is a very unique process where, like you mentioned, most it's like, here's my application, I'm going to apply, and then I send that in. I mentioned the first step to determining if you can be made eligible is to have that medical specialist send in a report. And so what you will do, and you can get that either through Children's Special Health Care Services, and getting that authorization to disclose protected health information. So the parent and family can sign that and send it to their specialist, and that way the specialist will fax medical information to CSHCS. It goes straight into our electronic medical records, so it's not like anyone is faxing over a fax machine that's printing out. It goes directly into our electronic medical records where it gets reviewed. Now, once a medical consultant reviews that, if they determine that you are eligible, you will receive an application packet, and it will have a letter stating, thank you so much for applying or thank you so much. We have reviewed your medical report, and based on our review, it is determined that you are eligible for Children's Special Health Care Services for, let's say, a diagnosis of epilepsy. And then they will say, then there'll be an application packet within that. In that application packet, you just basic demographics, but you can also put any other providers your child is seeing, any other medical conditions your child has, any equipment needs your child has at the time, whether it's oxygen, any durable medical equipment, assistive devices, etc. You will put all that information in there. And also there is what we call an income review payment agreement, and you'll fill out a form, and it's based on, you generally the last year's tax information, or if we're later in a current year and you've already filed for the current year, you'll use whatever they tell you on their line, whatever, and you'll put that information in. And then they also have kind of like a workbook guide, and it'll tell you if your family size is 2, and it'll have different ranges. If you make this much money, this is what your payment agreement is. And so once you sign that form and agree to that payment agreement, I do like to mention that it is kind of like a contract when you join the Sam's Club, that you join for a year. That's your membership for a year. And it is, so this is basically a signed contract that holds you to that payment agreement fees. But the fees range from anywhere, like I said, no payment agreement at all, if you're on Medicaid, to $120 up until the highest payment agreement is right under $3,000. And you will get monthly coupons, so you don't have to make that payment all at once as well.
Okay. So what types of treatments and services are covered by Children's Special Health Care Services, and how are those coverage decisions, or how do they relate to coverage provided by other insurances like Medicaid and private health insurance?
Sure. So in regards to having other private insurance, Medicaid, et cetera, CSHCS is always the payer of last resort. And so that means you will have to go, they will basically bill the primary insurance, and you will have to follow the networks of your primary insurance and follow, how their agreements are. So you will need to follow all that. But CSHCS generally, so if you were to have let's say you have an employer-based Blue Cross Blue Shield, you have Children's Special Healthcare Services secondary, CSHCS would generally pick up any of the co-pays, deductibles for any pharmaceutical meds, any testing being done, any labs, hospital stays, surgeries, but directly related to that medical diagnosis. So we also have the analysts at the state have a book that will have many different diagnoses, that have a multiple of other things that they may be seeing other doctors for, such as an epilepsy does have they may be seeing a variety of team of doctors. And so if it is appropriate and this is something that falls under that, what would be kind of the norm, it will get covered. And I think I missed one of your questions.
Yeah, just like, I guess are there restrictions as to what types of treatments or medical services are covered or are not in terms of children's special health care services, or does it basically mirror what is covered by insurance?
Basically it does, unless for some reason their insurance just doesn't cover something that I can't off the top of my head think of something specific to epilepsy, although you may, but I'm thinking about in regards to hearing aids. Most private insurances, employer-based insurances, do not cover hearing aids, but Children's Special Health Care Services does. So if it's just something that your insurance wouldn't offer, if there are, and I know especially if, in epilepsy, there are maybe not necessarily experimental treatments, but people may get to that point as well, right? And so they will not necessarily pay for things unless it's been well documented, and anything needs to get sent in by the specialist and recommended by the specialist, even for someone who needs to go out of state care.
Mm-hmm.
And they will cover many different things. I'm trying to think of, like I said, the different testing that people with epilepsy go through. If there are
like EEG or MRI or things like that.
Absolutely. Right. And if they, have to have hospital stays, those would get covered. Anything relationship to surgery. I don't know if how many people with epilepsy end up having to wear orthotics or braces or needing wheelchairs, things like that. As long as it's a proper and appropriate equipment, it would definitely get covered.
Okay. And again, just trying to think of some other things that children with epilepsy might need, but things like dietitian services for going on the ketogenic diet or things like that. That would be covered as well.
I would imagine so, but I do not want to say 100% that is, but I can find that out for sure for you and follow up with you if that would be okay.
Sure.
And
sure.
Children's Special Healthcare Services is a really complex program, and I've been here for 11 years, and I know quite a bit. But one thing I've learned from day one is never say absolutely to anything with Children's Special Healthcare Services.
Sure.
So I don't want to give out any incorrect information because I know how frustrating that is when someone tells you something and you're like, great, this is wonderful, and they're like, oh no, that, So I just want to, but I'm sure, like I said, anything that would be appropriate and expected under that diagnosis, as well as, where they are at in their severity level, right? If they're not responding to medications, et cetera. So it would be looked at, again, on an individual basis. But also, one of the things I was thinking of that CSHCS helps with is mileage reimbursement. So, many families travel very far to get to their doctors, and we can help. If you are not on Medicaid, we can help with mileage reimbursement. If you are on Medicaid, we can help you work with DHS to get mileage reimbursements for any travel you make to and from appointments. If you need lodging, if your child's having surgery and you need lodging to stay in a hotel, or you live in the UP, and we know if you live in the UP and you're going down to Mott Children's Hospital or Children's Hospital in Detroit, it's not a one-day trip. So we will also assist in paying for lodging for you to stay.
Oh, that's great to know. Great. And I guess kind of related to the question about dietitian services, are non-physician specialty services covered? So things like physical therapy or speech therapy or occupational therapy or dietitian, like I mentioned, things that are specialty care or relate to the chronic health condition, but are not physician provided. Are those covered in general?
Sure. And generally speaking, when you think about it, it really is only specialists and not primary care. But we definitely cover therapies. We can cover primary physical therapy, occupational therapy, and speech therapy. But again, it is individualized, and it does go through a prior authorization process after you have so many visits. So they will look at, what's the treatment plan? Again, what is our goal? What are we looking to achieve? But yes, it would definitely cover all of that.
Okay, great. And how is coverage typically obtained? Does the specialist bill children's special health care services? Is the parent responsible for requesting coverage for each covered item or service, or do other insurance providers need to submit information? I just want to get a sense of how automated that process is and how much time and energy the parent needs to spend accessing coverage.
Sure. So I can share my personal experience. I was in the hospital. I knew my daughter was going to be born with Down syndrome. I had never heard of Children's Special Health Care Services, and the social workers at the hospital actually helped. They got all the medical information. They just had me sign the authorization form and sent it in for me. I don't believe I really even knew what they were doing, but I'm just like, thank you so much. And then at some point, a few months later, and she was in the NICU at the time, so once she got out, I received that you're eligible and that application packet. So typically that's the way it happens, is either through a specialist or maybe you're at your epileptologist and they tell you about children's special health care. Maybe you meet somebody in the waiting room in the hospital and they tell you that. But generally, it's typically either a social worker or a provider that kind of brings the information to the family. And then once the medical gets submitted, once the family sends the application packet back and shares all the information, all you have to do is when you go to see your specialist, you have to make sure that they are a Michigan Medicaid enrolled provider and that they do take children's special health care services as payment. Now, I haven't worked with anybody at any. And my daughter goes to all three children's hospitals, DeVos, Children's Hospital of Michigan, and Mott Children's Hospital, and in her 16 years of life, all of those providers at all three places take children's special health care. Most, because they're pediatric subspecialists, most of them do. Now, if you're in a private practice, that you just want to make sure, because if they are not enrolled as a Michigan Medicaid provider, we cannot pay them. So once you go in, you will just share. We send out a letter. It's called it's got the diagnoses on, your member ID number, and you'll just bring that in to your provider, and then they will bill us. They'll process all the insurance. You won't need to do anything with that. They'll submit the claims to your insurance at the primary and CSHCS, and as long as it's something that will be covered under CSHCS, you will never get a bill.
Okay.
So they will pick up the difference between what your insurance.
The provider that, yeah, okay.
Yes.
Sounds like the
And mostly
provider
it's
pretty much
very
coordinates all of
rare.
that in most cases. Yeah.
Absolutely. It really is pretty seamless process and very smoothly, it isn't very common that we get a ton of billing issues. I see a lot of billing issues more in patients who have diabetes, with all the different needs that they have and coverage that they're trying to get. But generally, it's a very smooth process.
Okay. And then in situations like you mentioned that are somewhat unique and maybe not necessarily covered by insurance, like you mentioned, transportation or lodging, those would have to be requested by the parent, I'm assuming, as opposed to it automatically, being taken care of by the provider.
Correct. And so I work at the state level with all the applications and everything comes in, and then we contract with every county local health department to run the Children's Special Healthcare Services program out of their county so they can directly serve the clients that are in their community, and they will know them better and their area better. So the parent can work closely with Children's Special Healthcare Services where they live, and they will actually do all that paperwork for them. They just need to contact them. They can come out to the house. They can get a case manager, and they can get assistance with care coordination or any of their other needs. So many times, especially in the beginning of a new diagnosis, parents were overwhelmed. Our children may be in the hospital at the time. We may not have any clear answers. We may be trying to take care of other kids. We may be working full time, and it's a very chaotic time. So they were wonderful for me, and they helped me get lodging for my daughter's heart surgery when I was, in that really beginning stages of just being overwhelmed and grieving and scared. So they did take a lot of that from me and really made it easy.
Great. So in addition to treatments and services, Children's Special Healthcare Services can cover some medical and adaptive equipment as well, and you've already mentioned a few examples of that. Can you explain the Children with Special Needs Fund and give some examples of equipment and services that can be covered, and maybe some other things that tend not to be covered?
Sure. So Children with Special Needs Fund, their mission statement is it provides family-centered support for children with special health care needs by assisting families to purchase equipment that enhances quality of life and promotes health and mobility. The Children's Special Needs Fund is a program within the Children's Special Health Care Services division, but it is operated entirely by donations and private funding, so no tax dollars are used for this special program, but they can provide financial assistance to families to purchase equipment for their children with special needs. And I will give you a little information on what things the one requirement in order to apply for Children's Special Needs Fund request for some type of equipment or one of the things that they would provide is that the child does need to either be on Children's Special Health Care Services or be eligible. So maybe the child's no longer on Children's Special Health Care because maybe it wasn't, it wasn't effective financially. They were not putting out as much money any longer. But as long as they disqualify for it, then they can, and they also have to check for other funders as well, because everything we do is a payer of last resort, it seems, but Children's Special Needs Fund is as well. But there are many different things that they can fund. There are adaptive recreational equipment, air conditioners or central air. And that would be basically for somebody who either has severe asthma, maybe a major heart defect, maybe something with their epilepsy that they cannot be overheated and are not able to handle that at all. You apply for a ceiling or stair lifts, electrical upgrades that generally those are for when someone needs to come home on a vent and they need to have that electrical upgrade put in first. We do platform lifts, wheelchair tie-downs, different transit options, and this would be up to 2 per child. And this would basically also, such as a trike, we do special needs tricycles every 2 to 5 years. A tourney seat, which I'm going to be very honest with you, I do not know what that is, so I apologize. But they can use also vehicle accessibility devices. They don't do any accessible vehicles. We do not do that, but different devices that they may need in order to transport safely in either a transport van or in some type of vehicle. And also weighted blankets, vests, and wheelchair ramps.
Wheelchair ramps. Okay, that's good. I was going to ask about that specifically because I know I used to work for an agency that dealt with mobility impairments, and that was always a challenge, was finding someone to cover a wheelchair ramp. So that's really good to know.
Sure. And
now
the top 4.
Yeah.
Oh, go ahead.
Go ahead.
Oh, I was just going to say. So this was the top 4 approved requests from '94 to 2018, and 16% were tricycles, 18% were wheelchair ramps, 20% camp, and then van lifts and tie downs. But the application is fairly in depth, but the local health department, Children's Special Health Care Services rep, will help the family with that application process. So they will assist them, walking them through that, helping them, reach out to, because they may need to get quotes and stuff, especially if it's in regards to like a wheelchair ramp or something that's going to be built. They'll have to reach out to other companies, but they can help do all that so the burden isn't completely on the family.
Great. And how do families tell whether something is a piece of equipment is covered directly through Children's Special Health Care Services or whether it's covered through the Children with Special Needs Fund? Is there a clear delineation there?
Well,
like a wheelchair, for example. Like let's just use the example of a wheelchair. Yeah. Would that be directly through Children's Special Health Care Services, or would you apply through Children with Special Needs Fund?
Right. So no, actually, the Children with Special Needs Fund does not provide. They do not provide wheelchairs. That's one of the things they do not do. And so Children with Special Needs Fund is basically created to provide a funding source for other equipment that families can't normally get anywhere else.
Okay. And then, so in the case where someone needed a wheelchair and maybe got partial coverage through Medicaid or their private health insurance for the wheelchair, would that be an instance where Children's Special Health Care Services could cover the remainder of the cost, or
so yes,
is there a restriction on that?
Okay. Children's Special Health Care Services they do cover wheelchairs, so that is something that would be covered. Like I mentioned, really, Children's Special Health Care Services being so individualized, if it is appropriate and somebody needs a wheelchair and, it would be appropriate, we have all the information we need from the doctor and the physical therapist, it would definitely get covered. That does go through a prior authorization over at Program Review, which is a separate department than we are, but we work very closely with them. So anything that a person needs in order to, whether it is mobility, anything that we can do to assist with, making their life better, the quality of life better, getting them to the correct specialist, and learning about their health condition, we definitely make, all efforts to provide.
Great. And you kind of referenced that most specialists at the major hospitals are covered and accept Children's Special Health Care Services. But how do parents know if their specialist or provider is covered? Do they just simply have to ask, I assume? And and if they want to see someone who's maybe not currently on the list or does not accept coverage, Is there a way to get them added to the list? I guess what do parents do in situations where they need to receive care from someone, but they're not on the list or do not accept children's special health care services?
Sure. And this does happen. Many times it happens in orthodontia treatment for those who have some type of craniofacial disease or genetic defect or cleft palate syndrome. Cleft palate and lip, and where we would provide orthodontia. But so, right, they would basically, especially if it's a first-time appointment or if they're currently seeing them, ask the specialist, do you accept children's special health care services, and are you enrolled in as a Michigan Medicaid provider? And if they are not, but they are willing to enroll as a Michigan Medicaid enrolled provider, then they can go ahead and enroll. There is a provider helpline and a provider site that they can go on. I have never done that, so I don't think it's a huge process to do, though. Sometimes, especially maybe in a more rural area where maybe they don't, want to necessarily be a Michigan Medicaid enrolled provider or take all Medicaid clients, but they want to help someone who is on children's special health care services, they can enroll, but just maybe see that one client. Just because they enroll as a Michigan Medicaid provider does not mean that they have to accept all clients on that.
Got it. Great.
And also as they see a new provider, they just call either the CSHCS family phone line or their local health department and ask them to put a new provider on.
Okay. Great. So if coverage is only provided for treatments or services related to the eligible condition, how is that line drawn? Because you can rightfully make the argument that a wide range of conditions, treatments, and services are directly related to epilepsy. So, things like depression or anxiety or memory problems or sleep disorders or autism, all of those are very closely related to that eligible condition, but I'm guessing not all of those would be covered. Do you have any insight as to how that line is drawn, I guess?
Well, I believe, and I apologize that I don't have a complete clear answer on this. I do know, so in regards to like sleep disorders, so we do cover sleep apnea and CPAP machines, BiPAP machines, things like that, if they do have a sleep study and there's some type of equipment. And then that would actually be a separate diagnosis. So they would add on sleep apnea as one of their diagnoses. But we do not cover autism. Basically, ours are physical, medical conditions. And I understand because I do, like I said, have a child who has cognitive and developmental delays, and it's frustrating for parents because so often we feel like we're just siloed in pieces everywhere, and so they couldn't add anything for autism. We may have resources, either working like with the community mental health providers where they can get maybe services and supports for those other aspects of what happens when, side effects of medications, things like this from seizures. And so there are other supports that can be added in, just maybe not through children's special health care.
Right. So in general, if there is a condition that's related to that primary eligible condition, you most likely would just apply again or for that separate condition, like a sleep apnea. Like
correct. Right. And there are also maybe many things that isn't directly related to epilepsy, but that might be typical in many children, such as needing their tonsils and adenoids out. That's something that could be covered. Ear tubes. Mm-hmm. Many children need ear tubes when they're little. Moderate to severe asthma. So, there's even other things that may not directly be related to epilepsy, but would still be another qualifying diagnosis.
Right. Okay, so if coverage for a particular treatment, service, or item is not approved, what are the steps involved in appealing that decision?
So the steps are, and you might receive a letter saying, we've reviewed your child's medical report that came in, and based on this report, it might say your child is not medically eligible, or does not meet the criteria, or does not meet the severity. And so sometimes it's not always clear. And so I just want to let anyone who's on this call right now that might listen to it in the future that just at that point, the best thing to do is contact the CSHCS family phone line to see if you can get more information. Because many times, while it may say you're not eligible, and parents are stressed at this time, and they're thinking, oh no, I don't understand, because my child is very ill, my child is on all these medications, my child's in the hospital, right? But it may just be that we do not have the right information. Sometimes a provider will send in something, but it doesn't have all the diagnosis. It does not have the medications. So we always want to just call first, because it just may be that they need more information. And so if it is something that is actually, and this is denied, we cannot cover this, yet you have, I believe, 30 days to file for a department review. And then they will schedule, what they'll do is like a conference call, and we will have medical consultants on staff, somebody from the department review administration will be on there, and generally usually someone from the family center will be on there to advocate and support the parent. And many times, if it gets to this point, it may just be something that we just don't cover, like autism. It may just be something that there's not enough proof clinically, not enough proof done in, peer-to-peer reviewed publications that this it is not experimental. It could be, there just could be a variety of reasons why. These department reviews generally get resolved before they ever get to that point. And we want to resolve things for families. And for instance, there, for a long time, families were trying to get continuous glucose monitors for their children with diabetes, and I think they're at a point where they're covering them on an individual basis now. But if there is a need of why a child with epilepsy needs something, that it's medically necessary for them, you can definitely have your child's specialist advocate for that. But by all means, we definitely want you to. In Children's Special Health Care Services, we want to help everyone. So if it's something that, can the medical consultants review that and say, oh, yes, okay, they can see it. And, yes, this is something that we can approve based on X, Y, and Z, then it can get approved. So it's just like I said, Children's Special Health Care Services is a very complex program. It's not very clear-cut. And because it is so individualized, 2 different people with epilepsy may get approved for this and may not, depending on their situation.
Right. Okay. So you've mentioned a few different access points to Children's Special Health Care Services, the Family Center, your local Children's Special Health Care Services office, the state administrative office, the website. So are there benefits of one access point over another, or certain circumstances where one access point is more or less appropriate?
Well, either way, I think, definitely either working through the Family Center or calling the CSHCS family phone line is always a great start. We can get all of that information to you. We also have email address, and we do send out information. We can't send out any private health information that way, but we can send an email to a family stating these are the things that you need to do, have your provider do. We can send an authorization to disclose protected health information form so they can start that process. But also, working with your local CSHCS office is really wonderful, because they'll kind of guide you through that whole process, and they'll get to know you and your family and really work to connect you to any other community-based resources and supports and maybe other needs that you have that we don't cover, but they know where to go. So I always think that's always a great place to start. And you can contact the CSHCS Family Phone Line, and we can connect you directly to that local office as well.
Okay, great. So makes sense to get to know both your local
Yes.
office and the Family Center. So,
Yes.
well, speaking of the Family Center, let's talk more about that. The Family Center for Children and Youth with Special Health Care Needs, or the Family Center for short. So beyond assistance with accessing and navigating coverage through children's special health care services, I know the Family Center provides a wide range of education and support services for children and families. Can you spend some time talking about the many services that are available and the people who work with and for the Family Center?
Sure. So the Family Center, like I mentioned, we support all families in Michigan who have a child with special needs, not just special health care needs. And we are the parent-directed center, and what that means is we are all parents of children with special needs. We are a small section of 9 parents. And so we bring our unique perspective and voice to the table by promoting family professional partnerships, working very closely with CSHCS on any initiative that they have going on. We are all heavily involved. And, we work to make sure that letters and things are understandable for families. And like I mentioned, we are all parents of a child or a young adult with some type of special health care need, a wide variety of different diagnoses and a wide variety of experience and ages. And we also even do have a parent on our staff who has lost a child. And so we are also doing some current parent mentor trainings for bereaved parents who have gone through that and would like to support other parents who have lost a child with special health care needs. And we are all trained as parent mentors, and we really work to try and help ease the isolation that so many families feel, especially it can be definitely in the beginning, but not even just in the beginning. And I know with epilepsy there may be so many ups and downs. Things are good, kind of like that roller coaster, right? And so we really want to do all we can to support those families. We do have many different trainings that we're doing. We're currently doing what we call Parent Connect calls, something very similar to this, except it's through Microsoft Team meetings. And once a month we do different topics. The one that we will be doing in August is on the My Able account program. So I can get that information out to you, Russ, or you may already have that if they would like to sign up for that, or they can also join our email list. And anytime those trainings happen, we will send them out to you. And we do parent mentor training. So the Family Center also oversees the Michigan's Parent-to-Parent Support Network, which is an evidence-based model of peer support. And a parent can call in to be matched with a parent mentor, and that match can be made based on needs of the referred parent. And so they would just basically call into the Family Center and do an intake, and maybe their child was just diagnosed. Maybe their child needs to have a particular type of surgery, and they would like to connect with a parent that has had a child that went through that surgery. We can do that. And we are an official alliance member of the Parent-to-Parent USA, which is the national parent-to-parent program. And the great thing about that is it is all evidence-based, and the model of peer-to-peer support really works, and the evidence shows that after receiving mentoring, after being connected to a mentor, parents feel more equipped to cope with their child and their situation. They're able to view their family and circumstances more positively, and parents ultimately feel empowered to partner in the decision-making process. So it's really important that we connect them. And in addition, we do parent mentor trainings once a month. Everything currently we are doing all virtual. And so we have a parent mentor training coming up at the end of this month, which will be 3 days. I think it's 2 to 3 hours for 3 days. And so if there's anybody out there that would like to join us and volunteer to be a parent mentor in Michigan, that would be wonderful. We're really trying to build up our base here, and moving everything virtually has really been wonderful.
And as a parent mentor, you would essentially be one of those peer-to-peer support providers. Is that the role of a parent mentor?
Somewhat. So basically, there is an official process that goes on, and because it is an evidence-based model, basically, if someone were to call in and our parent consultant that oversees our parent-to-parent support network went in, or we have a database where she'll put in the criteria, and she'll get a list of people and pick out which maybe that the person that looks like it will fit best. And so what she first does is, before giving any information out to the parent that's looking for support, we contact the parent mentor and first make sure it's a good time. Because as parents of children with special health care needs, we know that one day may be great and the next day things are, not good, and we want parents to be in a good space emotionally and mentally and physically, and also have the time to support another parent. So we'll check. And if they're not, that's absolutely fine. We understand. But if they say yes, then our parent consultant will contact the parent seeking a mentor and give her that other parent's information. And we just ask the parent mentor to contact the parent within, I think, 24 to 48 hours. It has to be within that set time, because when we know families are calling, they're in need. But then they can connect. Sometimes it may go on for 6 to 8 weeks. Sometimes if they live, in the same community, they may become best friends for life. And you just really follow the needs of the parent that's seeking the mentoring. But we do have a guide, and we do train mentors on, the grief cycle, how to do active listening, how to support families without enabling them, but guiding them, and, having empathy. We also discuss self-care and shared decision-making skills, which is something really big to help families be able to partner with their partners and ultimately, get ultimate quality of care for their child.
Great. So you mentioned shared decision-making. That flows into our next question, which is what are some of the overarching principles that guide children's special health care services in the family center in their service to families? Well,
a part of all of that is really that we want to help strengthen and support children and youth with special health care needs and their families. We want to, look at it as the whole. We're not just looking at the child. We're not just looking at families, but the whole family system. And, we want families to be connected to the systems of care that they need and help get them to the systems of care that can take care of their child appropriately as well. And we really work on providing that family-centered care, being very family-focused, culturally competent, meeting the families where they're at, knowing that we all have our own unique family culture, correct? And really supporting families where they're at, and just trying to help maximize the health of that child, and and helping them to become better in whatever capacity that we can. But we really, our goal is to support families at the community level, at the macro bigger level, and connect them to all the supports along the way that will help them. So many times we don't, as families, we sometimes feel like we're just banging into a wall. So we kind of want to be that support, that financial assistance when you start having big medical bills coming in, and just to connect you to anything that can help make that family's life, that child's life, better, getting them to, providers within their area so they're not traveling hundreds of miles, connecting them, making sure they do have access, making sure they do have transportation, and, helping them coordinate services for their child.
Great. And that just reminded me of a question has telemedicine been covered in general? I know that's, use of telemedicine with the pandemic has skyrocketed, and I know part of the barrier to accessing telemedicine services was the lack of insurance coverage. So I'm curious, has Children's Special Healthcare Services covered telemedicine services, and do they intend to, as the pandemic comes to a close?
Yes, so that is great. We have so many, for all the horrible things the pandemic brought, it sure did bring some beautiful things as well, such as telemedicine. And yes, they are covering them. I do not know if the decision is made to, I know they are trying to keep that. I don't know because they're still, the budget talks are,
right.
Fiscal year ends on 9/30/2021. So I think we're all crossing fingers, and there may be newer, I just got back from vacation, so there may be newer information than what I know, but I think we're very hopeful that will continue. I know just for me and my daughter, it was a huge blessing because I didn't want to take her anywhere. She's complex. She is very high risk of catching COVID, so I didn't want to go anywhere, but we needed to see these doctors, and we saw many of her specialists via telemedicine, and I believe, that will definitely change, especially for children and youth with epilepsy. They're, just being able to access some of the top epileptologists when you don't live anywhere close, when you may not have transportation, when you're in the middle of winter and you're in the UP. So I'm very hopeful, and if I get any information on that, I will definitely share that with you soon.
Excellent. Okay, so if someone wants to learn more about Children's Special Healthcare Services or the Family Center, are there any webinars or websites or other resources you would recommend?
Well, we do have our CSHCS and Family Center website. We are in the process of updating our website right now and trying to make it more family-friendly and just overall a better look, easier information. But we do have some trainings on there where we do have one that's called What is Children's Special Healthcare Services? We also have our parent mentor training online. They could do that online if they would like. We do not have currently a What is the Family Center, but we do have a lot of our information on there. And we do, with the Parent Connect calls that we are currently doing, we do, depending on when it is, maybe we do a Family Center 101. And currently we are doing professional Connect calls some are every month and every other month, alternating CSHCS, the Family Center, and the CSN Fund. Those are specifically for professionals, but we can always, like I said, we will definitely be doing more in regards for families as well. And I would like to mention really quick, because I did forget a big piece of information on the Family Center, and one of the things that we do offer that many of your families would be interested in is we offer camp and conference scholarships. And so, like I said, in order to access these scholarships, you do not have to be on Children's Special Health Care, but we will, just trying to get to my page real quick, excuse me. The camp scholarships covers children or youth with special needs at ages 5 to 21. It is not based on family income. It's a first come, first served basis. And it does not need to be an overnight camp or a special needs camp. Just must be licensed and connected to a school or city, township, parks, and rec. And we do that every year starting January, and usually it's till the end of March or when the funding runs out. Of course, with COVID and everything changing and so many camps went virtual, it's been a little different, but something to keep an eye out for. Next year they will cover up to $250, which was a great help.
That's great. That's and we're fortunate that our Camp Discovery and Solstice Camp that we offer through North Star Reach are free to families. But we certainly use that a lot prior to that when we did have a fee. And certainly there are plenty of other camps that children with epilepsy and young adults with epilepsy can benefit from that outside of our North Star Reach ones that would absolutely benefit from that funding. So that's a really great resource.
And North Star Reach is an amazing organization. My daughter will actually be at Solstice Virtual Camp this year. She's very disappointed that it's still virtual, but she'll be able to attend next year, hopefully in person, right?
Great. Yes. Yes. I'm
hopefully
99% confident. So okay,
right,
well,
I'm with you.
Before we open it up for questions, do you have any closing thoughts on this topic that you'd like to share, or should we just open up for questions?
And last thing, one last thing is we do conference scholarships as well. So if you would like to attend a conference about your child's diagnosis, whether it's epilepsy or one of their other diagnoses, it's not based on family income. You do not have to be on CSHCS. It will cover one parent and or youth, because we do youth scholarships as well, ages 14 to 26 years old. It must be in the U.S., so it's not just limited to Michigan. But we will cover the cost of registration, lodging, meals not covered by the conference, mileage reimbursement, or if you would like to fly, we can cover one parent, or if it's a youth conference, it would be one parent and one youth. And so, conferences are not cheap. They can spend over $3,000 to get to a national conference. So that is open yearly. I mean, it is always open. It doesn't open and close. Yes. So we encourage anyone to please.
That's great. And again, our conferences, we will always, reduce or waive the fee upon request, and they're very low fees when we do have fees. But certainly, like the National Epilepsy Foundation has their pipeline conference, and they have their community day, which is that would have significant travel costs to be able to get to there. And there's a whole host of other conferences through like rare epilepsy organizations and things like that people might want to participate in. So that's, again, really, really great resource. Okay, with that in mind, I guess I thank everyone for participating, and again, Lisa, thank you so much for such a thorough and helpful overview of Children's Special Healthcare Services in the Family Center. I've always been happy to have you guys as a partner and as a resource for our families, and it's been great working with you, and we love that we can work together so effectively to help families. So thanks again for joining us, and if anyone does have any further questions, certainly feel free to call us at 1-800-377-6226 or visit our website at epilepsymichigan.org. Thanks, Lisa.
Great. Thank you so much, Russ. Have a great day.
You too.